Assalamu alaikum, and great presentation, Farah. I really enjoyed that. Okay, so thank you again for the opportunity to share a little bit about my work that I've been doing for my master's thesis. It is very much a work in progress. I'm not done yet, so I'm sort of like trying to wrap things up and in the middle of things. So I'm going to share what I have so far. So for my research, I did an evaluation of the region of Waterloo Public Health's Warming, Cooling, and Clean Air Spaces Network. And I also use that evaluation as an opportunity to explore intersectoral collaboration, which is something that's really relevant to public health. So climate change adaptation is super important. It's an important topic because we know that even if we reduce greenhouse gas emissions, we're still going to feel some of the effects because the trajectory has the ship has sailed, right? So we're sort of in it right now. But anyways, let's move on. Oh, how do I click something or I think oh, you're good. It just takes a second. Okay, so just a little bit about me. I thought I'd share. I have a background in biology and writing in my undergrad, and I also went to Teachers College to become a teacher. I'm currently still supply teaching, but I'm also hoping to shift to something in public health, and that's kind of what brought me to Waterloo to explore climate change a little bit deeper and the public health space a little bit more. So I reached out to Dr. Dodd, who's a researcher in the School of Public Health, and he focuses on global health, but also locally on climate health issues. And so, yeah, I've had I'm near the end of the program, but it's been a great program in terms of exposing me to different qualitative and quantitative methods, and yeah, it's just been an interesting time. Okay, so let's get into the project background and context. So this one here. So as I mentioned, my research project was primarily an evaluation-focused project. I was looking at how the Waterloo network is functioning and how it's working for the partners. Just to give you a little bit more background, the WORCAN, or the Waterloo, the acronym for that network, the WORCAN, I might mention it a few times, it's a group of organizations, most of whom are able to provide spaces to the public in the event of an extreme heat or cold or poor air quality situation. And so they're providing this these supports for the general public, and this network sort of connects them together to sort of coordinate things a little bit better, have people talking to each other, and maybe fill in any gaps that are there. And so Region of Waterloo Public Health wanted to understand how this network is working. It's been going on for 15 years. They've never done an evaluation, and so the purpose was sort of to understand that a little bit more. I think I might have skipped a question. If I go back, can I just that what I was talking about was kind of about this. The main research question I hoped to answer was, what are the facilitators and barriers to intersectoral collaboration in a public health-led community-based climate adaptation? So that was kind of my anchor in terms of, what am I trying to do? What do I hope to achieve at the end of this, at the end of the project? Okay, so yeah, now I can go to the next slide. So just a little bit of background and context. So we know that climate change poses severe risks to planetary health. You might have heard of the planetary health, the boundaries of planetary health, right? And so if you reach tipping points, then it sort of goes to a point of no return. And so it's just it's a serious thing. We want to avoid that. And it's only relatively recently that public health has declared climate change as an emergency. So the importance of addressing it at the population level is fairly new. So even though we know climate change has been happening, different sectors have been trying to address it, public health and climate change is sort of still relatively new. And so in terms of the health risks, they're quite diverse. So it ranges from malnutrition, mental health, allergies, the usual cardiovascular, respiratory diseases, infectious diseases, and it's sort of, you have the direct effects, and then you also have the interacting secondary effects and tertiary. So at all those different levels, you have that. And then Canada is particularly vulnerable. We're warming at twice the average, the global average, and then the Arctic and other, the North would be affected even more. And a projection is that the future heat-related mortality due to climate change by 2090 is projected to increase as much as like 10%. So it's really quite a lot. And we have a window of opportunity to do something about it. So in terms of public health's role, like one thing we can do is focus on adaptation. And adaptation, you might have heard of like mitigation, adaptation. Mitigation is reducing those greenhouse gases to begin with, and adaptation is like doing something about it. Like how can we adapt? How can we respond, right? So let me just see here. So just like a little bit of background. I'm not sure, everybody might be coming from different backgrounds, but public health, it's all about preventing disease, prolonging health, and thinking about it at a societal level. And so there's documents that kind of outline what are the essential functions of public health. And all of those 6 essential functions can be connected to climate change activities. And just to give you one example of what public health can do in relation to climate change is like health and vulnerability assessments. So that is something that is happening. Those assessments kind of look at a specific region, and they look at like who's at risk, what are the risk factors, and they tie in like data and projections, modeling, all of that to sort of quantify and also provide detail like for different groups, vulnerable groups. And Waterloo Region had an assessment done in 2022, and they identified a lot of different things, but the one that kind of stands out to me is extreme heat is like the highest priority. So we probably all know that from personal experience too. Like we kind of complain about the weather, but it does pose a significant risk for increased morbidity and mortality in terms of like public health framing. Okay, so other examples are creating heat alert systems and also improving urban green spaces. There's a lot that people do. There's a lot of work that's being done. Sorry? Oh, okay. Okay, no worries. Okay. And then, so like my research project, there's 2 pieces. There's the evaluation, and then there's intersectoral collaboration, which is like the theoretical lens that I looked at, that I put on this more practical applied project. And so intersectoral collaboration is a strategy promoted by some of the big names in public health. So like our own Public Health Agency of Canada, the World Health Organization. So like people are kind of studying this. And like why this is so useful to applying it to climate change situations or contexts is because climate change is such a complex, multi-causal thing, and intersectoral collaboration is all about bringing different sectors together and sort of not just like having silos and like one person is working on this, but looking at the big picture of things and seeing how we can work across sectors. And so I haven't really looked into this too much, but like other examples, in case you guys are interested, is like One Health, disaster risk reduction are both examples of like places where intersectoral collaboration is quite common. And so when I was doing the literature searches, I didn't find so many examples in public health like locally. And so that was kind of like a gap that I tried to address. Hopefully this research might address a little bit of that, but it has been used in like other things. Okay, so just more specifically, the model or framework that I use for my research is this one, the Bergen model of collaborative functioning. So this is like more of the theory side of things, but this helped me when I was doing my analysis to sort of figure out like how is intersectoral collaboration working in this specific case. So it's a lot, but like really there's 3 parts. There's the inputs, there's the collaboration piece, and there's the outputs. And so it's an example of a systems level model where you're kind of looking at the big picture, and like all those arrows are sort of pointing to the feedback loops. And so, yeah, like this was just in terms of like this specific model, I can speak to like why I chose it, and maybe this might be useful for people who are doing graduate studies. Like there's a lot of different models out there, and I think the most important thing is probably just making sure you can justify why you have selected this one. And for me, this model worked because it was general enough to sort of capture like a case like that I was looking at, and without getting bogged down into like too many details. Like it's sort of a flexible model. So like I think that's why I selected this. Okay, so let me just quickly go over the methods that I used for my project. So the approach we took was a community engaged approach, and you might have heard of participatory based research, and that's sort of like the extreme end where you're really collaborating heavily with your research, your community. Like in my particular case, it was still a collaboration. We were still engaging with the Region of Waterloo public health partners, but it was sort of like as researchers, we were able to, do more of the researchy things. But that input was really important to the project as well. So it's like a fairly broad spectrum is what I want to highlight. Like you don't have to just have like a heavily community involved project. It's still okay if you have less engagement as long as a fit is there. So with that approach, we also had that community academic partnership, so between the University of Waterloo and Region of Waterloo Public Health. And again, the two components, there was an evaluation piece, which is fairly common in public health, and then the more like qualitative methods that I drew upon were case study. So the data sources, we had one focus group with Region of Waterloo Public Health, and then we interviewed the participants who were members of the network, and then just some observations, and a little bit of a document review. So taking all of that together, I was able to apply some thematic data analysis to the data that I collected. And this is what I'm still working on. So I'm kind of like here right now, but I can share an overview of what I found. So like thinking back to that question of what are the facilitators and barriers to like intersectoral collaboration in this particular context, the preliminary analysis shows to me that like participants did find it beneficial, and like that model that I showed you a picture of helped me interpret the data. And what really stood out in terms of like the collaboration space, like that middle space, was the communication piece, which maybe it seems straightforward, but like partners valued that for different reasons, like practical reasons, time saving, but also like maybe it was hard for them to express like exactly why they found it so useful, but they it pointed to like something being there. And so like public health can take that information and like say that this project is worth continuing because like the partners value it, or like there's like that connection there. So the other important thing was the contextual factors piece. So that wasn't really like, if you go back to that model, the context is important of where like a partnership takes place, like those contextual pieces. And so like factors like homelessness in Waterloo region, like mental health, addiction, substance use, all of those things are, like are not explicitly stated as part of the network at all, but the people who are working in this environment, or who are supporting, who are interacting with like people who are using the services, like that came up again and again. And so that was interesting to me because like the network itself is not set up to like meet those needs. It's sort of like a general purpose network. And but like it points to like maybe you have to like take this into consideration when you're designing. So that's sort of like me thinking about how to improve that network. It could be like a recommendation that like we present to public health. Okay, so this is still in process, but like in terms of the outcomes, like I could say that like we are able to support our community partners in this way by contributing like a practical, by contributing practical findings that they can use to improve their health promotion program, because this network kind of fits under that aspect. It's both health promotion and also like sort of emergency response, which is like part of the essential functioning of like one of the things that public health does. And then just it also allows for like future research opportunities for like other students. Like if you're working with partners, community partners, like different projects come up, and then I think it just sort of builds that ecosystem of those connections, those relationships allow for more applied research to be done. And then also, I think we also don't necessarily have like a very big evidence base yet on community-based climate adaptation in public health. And so I'm hoping that this can contribute to that a little bit. And I think just one more slide here. like it's a little bit connected to the previous one, but just hoping to, like when people are making decisions, policymakers or decision makers, they're looking to have some sort of evidence base to justify their decisions. And so like a case study can provide like something like a beginning, an example, maybe other communities can learn from that, or, you know, it starts a dialogue, right? So the other thing with climate adaptations is, like, this is something that my research did not address, but like we have this idea that, you know, we do these things and they're going to have an impact, but it's really hard to connect like impact to health outcome. And that's something that when I was reading the articles, that came up again and again, that we don't know if having these warming spaces actually prevents mortality, or right. Like, so we're doing this, but we don't really have proof. And so it's just hard to like connect the two. So that speaks to the challenges of evaluation work. Like just designing about studies in a way that you can like tangibly link things. So that's something that, you know, we need to do more of. And then the intersectoral collaboration piece, like I think the model I use, it's just a model, it's a theory. So really it's, and people are still inventing different models. Like, so it's still like kind of like a intersectoral collaboration is sort of a really big thing. And again, it's difficult to study because it's, there's many pieces to it, and the more work you do on it, the better you can understand it, because it is a pretty powerful thing. Like in health in all policies is another example of like a strategy that's advocated for, different organizations are pushing for it, but like, you know, how can you support that? How can you justify using it, like just with more evidence and research on that? So I guess that's it from me. Thank you so much. I'd be happy to answer questions. Yeah. If that. Oh, sure. Yeah, absolutely. If I go.
Yeah, so can you explain the interaction between the different parts and how you're able to use that as a equivalent to evaluate with actual, with a tangible example in different sectors?
Sure, I can speak to this a little bit more. So the way I used this model was, so initially the way it actually played out is I didn't know I would be using this model for like the theoretical basis of it. So when we were designing the study questions, interview questions with the participants, I didn't have this model in mind. Like I had a general sense, I had started looking for theoretical models, but it was sort of this iterative approach of, okay, I'm going to develop the questions. We had like evaluation questions in mind. Like we know we want to find out what's working, what's not working, like the big picture. And like what's working, what's not working is another way of saying facilitators and barriers. And so we had that in mind, but I didn't connect my questions directly to this. But in the analysis, I used these as the code headings. So like when I was coding my interviews, I was looking for examples of like the mission, like when, or if, like especially in the collaboration space, so like roles and structures, like what are people doing? And so like each of these terms has been defined by like the people who are using this model. And so I kind of use that as like the starting point for building my understanding. And what was interesting is like when you're coding data, it's like not all these categories fit. So like I sort of had to add my own codes, I guess, to sort of like to make sure it made sense for my particular case. So an example would be like an interesting one is like input interaction. And so that one is talking about like how like the different inputs, like partner resources, mission, financial resources, like how those three things interact and contribute to like the collaboration space. And that was like a tricky one to sort of like understand and try to like identify. And not all of the codes were like equally represented in the data as well. So and we had like a fairly small sample size, like maybe like 13 participants were willing to speak to us about their experience. So I mean, you do what you can with what you get. And so it was sort of like useful in the analysis though, I would say. So like it definitely was informed how I understand like what happened and how I'm gonna like write about it. So I don't know, I hope that helps. It makes it a little bit clearer. Mm-hmm. Yeah.
Wait, up with intersectoral collaboration.
Yeah.
How diverse are the sectors that you're talking about?
Okay. So in this case, in this particular network, I'm talking about like it was represented by like different government departments, so like transportation, paramedics, like police, like it was sort of like quite diverse like in that way, and also nonprofits. So it's sort of like it was not just public health. So I think that's what I mean by intersectoral collaboration in this particular example. But like you can also take it broader, like in other examples, like maybe the One Health, you might be having, like it could be like, I don't know, like an organization, like a company that is doing, who's, I don't know, like a meat production company or something, meat packing and public health and maybe like some other education thing. Like it could be like as broad as that. So the intersectoral collaboration is just like different sectors working together. In this case, it was mostly like municipal, regional, and nonprofits. So it was not limited to like public health is what so that's why I feel like I could apply it in this case. And other words for it would like intersectoral collaboration happens in networks, in partnerships, like, so those are kind of like the context in which you could study that or look at. Yeah. Does that make it clear or no?
It's because I was thinking of, and I'm not, now I don't apply to it, but as an example, I attended a seminar once, actually quantum research related to climbers, like finding climate change censure. But I don't know if that would count then as, you know, an intersectoral collaboration in that case.
Yeah.
I don't know if you're talking about more so not like different academic structures, but more so different government bodies.
Yeah.
Is that-
Yeah. I think I think like it's more an applied, like the way I'm using it is like more how can different groups, like how can different groups collaborate together? But I don't think like it's wrong to sort of link different academic disciplines. I think it would still apply, like, because it's sort of this idea of crossing boundaries and not just limiting it to like one particular thing. So yeah, I think it's like a approach of like learning from different things and like coming together. Yeah. Yes.
Sorry, I just had a question about about the participants. How were they recruited? What was the division of sectors?
between them, and then also what was your criteria for
Yeah, for sure. So the recruitment process was really interesting to design. And it required us to, like, that was where the partnership with Regional Waterloo Public Health was really important because we couldn't have done it on our own. Like, we couldn't just go to these organizations. Like, there was a list. It's like, I don't know if it's publicly available, but I think there's a list of, yeah, like we wouldn't have known who to interview really. So like Region of Waterloo Public Health sent out that email inviting people to participate. They like advocated for people to participate. They wanted this evaluation to be done. But then it was voluntary. So it was sort of, you're not getting an honorarium or any like, credit or anything like that. It's just if you feel like you want to share. And so like, I think that definitely biased like who participated, like people who cared about like what's happening in these spaces, like they were probably more likely to participate. So there's probably like a bias there. And it was not a straightforward path in terms of like getting like a lot. We were expecting like a lot of people to participate. We were expecting like everybody to participate, but it was like very slow. So that it took like maybe 5 people participated. Then we sent out another email and then 5 more. In terms of the breakdown, it was sort of, I would say it was like I have the numbers, but I don't know them off the top of my head, but it was like mostly regional, I think. But it was like, it was a mix between, it was like 70-40, 70-30, like nonprofit. There was no provincial. So it was all like within Regional Waterloo. So Regional Waterloo, it has like Kitchener, Cambridge, Waterloo. Like, so some were just municipal and some were regional departments. And I would say like about 30% were like nonprofit / like advocacy type groups. And then the rest was all like government departments, but like different government departments. So like fairly, it wasn't like all public health. I think we had like one public health person talking. So yeah.
Because I was wondering, like, if you had any tech sector people there and what their views on this so that they have.
Yeah. Yeah. So that's a good point. Like who was not there at the table and who didn't share. And I don't think we had any like tech tech people. No, I think the closest was like someone talking about like climate solutions, like or sustainability. Like we had a couple of people talking about sustainability like broadly, but not really, solutions like that. It was very much focused on like the like just the spaces itself, like the public spaces. So that's another thing. Like the network is able to provide. It's not really doing anything per se apart from connecting people. So it's very much like organizations are already doing what they're doing, but like that coordination, talking to each other is sort of, what the network adds. I think. Yeah. Mm-hmm. Any other questions?
So thank you for your presentation.
I'm sort of interested in your great bulk here. Could you elaborate what is meant by a hint having souls?
Sure. Like it has an example of that.
Yeah. So in this model, like the outputs are defined as like additive, synergistic, or antagonistic. And so what you want is synergy, like you want the sum to be better, greater than like what organizations could do on their own. And then antagonistic is like if you're like by being in this partnership, you're actually like hurting the outcome. So I think what my results found, or like the data overall, kind of leaned either towards additive, like, or synergistic. Like you kind of fell in the middle. Like so, additive would be like nothing is changing by being in this network. Nothing is really like different for the people. And so, in some ways, by being in the network, the partners didn't really get anything like tangible. Like they didn't get more space. They didn't get more money. They didn't get more staff. Nothing like that. But some people were saying how by being in this network, they were able to. They had this peace of mind that okay, like our place is closed, but like there's this other location that has space available, and so like there was that synergistic piece there. Like, like if they weren't part of this network, maybe they wouldn't know about this, or they wouldn't have that like overlap of services. Like there's that coordination piece there. Antagonistic is like if they were like as a result of being a part of this network, people are actively like, experiencing some sort of harm, or like maybe it's causing like one space to, I don't know, like be, I don't know, like it's taking away from a space. So it's sort of like that. And I guess like this model could be applied to like different situations. Like I think I'm choosing to apply it to my particular case study, but it has been applied in like bigger programs. So like health promotion programs, or educate like that involve like education and like activities and like a more complex sort of program where like maybe there's like a limit to like if you're diverting staff to one program and is like impacting something else, or like maybe there's some tension in like how you're spending your money, or there's conflicts, and so like as a result of being a part of the network, you're actually like your organization is suffering. So it's sort of like in other contexts it might be more applicable too. So yeah. Okay. All right, cool. Okay.